Hello everyone, this is Dr. Mohsin and today I'm going to teach you how to do the antenatal examination. As in every examination, first of all we need to explain the procedure, the position, the exposure and the chaperone as well. So in this case, we are going to look at the tummy and we are going to touch the tummy and then we will be listening to the heart sound of the baby using this instrument called fetoscope, and we will also measure the size of the tummy using this measuring tape. Then position would be, female would be lying on her back and exposure would be above the waist. And remember, medical team would be with us to ensure the privacy and the dignity of the female. In this procedure, doctor, first of all you need to ask the patient to empty her bladder. This is so important. Okay, alright, so we are going to start. First of all, we need to expose gently, right? Now we will start the inspection. First we will be inspecting from the foot end, right? First we will look at from the foot end, then from the right side, for any redness and swelling, any visible pulsations. You can see that tummy is protruded and umbilicus is everted. Alright, there is no visible abnormality, no visible pulsations. Alright, so after the inspection, now we are going to do the palpation. Okay, so for the palpation, first of all, we need to ask the patient if she's having any kind of pain anywhere, and then we should warm our hands and then first of all check the temperature and compare it with the surrounding. So after checking the temperature, next thing would be the tenderness. So we will be doing the superficial palpation here, looking toward the patient's face. Start from the left iliac fossa, make S. Right iliac fossa covering whole tummy. So after that, doctor in antenatal examination, there is no need to do the palpation. Now I will move towards the Laporte maneuvers. So in Laporte maneuvers here, doctors, you can see, first of all we will be doing the fundal grip, then the lateral grips and then the pelvic grip as well, to see which part is presenting in this case. So we are basically going to check the lie of the baby. So how to do the fundal grip? First of all, from the foot end with our two hands, we will be starting from here and moving towards the sternum to see where we are able to feel the part. So doctors, if it is a breech presentation, then head would be upward. Here we will be able to feel soft, hard, round structure. Alright, that would be the head of the baby. So this is fundal grip. Head would be hard, round structure. Alright, so next thing is the lateral grips. Now how to do the lateral grips? So your two hands should be on the both sides of the tummy. Fix the one hand. So I am fixing my right hand now and then I am moving with my left hand. So here doctors, I am able to feel irregular structures, means these are the limbs of the baby. Then fixing my left hand and now moving my right hand. Feeling. Here I am able to feel the hard flat structure that seems to be the back of the baby. Now I am going to do the last maneuver, that is pelvic grip. So again, using my two hands, I am going to feel the presenting part here and I am able to feel a soft bulky structure that seems to be the buttocks of the baby. So this is the one of the most important part of antenatal examination. So first we have done with the fundal grip, and here it was hard round structure, that was the head of the baby. Then lateral grips, fixing left hand and moving right hand, it was hard flat structure, that was the back of the baby. Then fixing right hand, moving left hand, it was irregular structure, that was the limbs of the baby. Then pelvic grip, and it was soft bulky structure, that was the buttocks of the baby. So here it is the breech presentation. Now doctors, next we are going to listen the heart sound of the baby using this instrument fetoscope. So we should place this instrument where we are able to feel the back and the head on that side. So if head is here, and if back is here, we are going to place it here. If head is here, back is here, we are going to place it here. So I am able to feel back here, so I am going to place it here. I will place and I will listen, leaving both my hands. So ideally I should listen for 1 minute, but for the purpose of exam and shorter time, I will listen for a few seconds. Okay, last thing doctors is the size of the tummy. So using this measuring tape, I will be placing the lower end on the pubic symphysis, keeping the inches above and the upper end at the where I was able to feel the head, the hard round structure. So inches above, centimeters below, and then after measuring this size I will turn. So this is 36 centimeters, that corresponds to the weeks of the pregnancy. Alright, so that's all, doctors. I have done the inspection, palpation, temperature, tenderness, then the report maneuvers, fundal grip, lateral grip, pelvic whip, and then fetal heart sound listening, and last thing, size of the tummy. That's all from antenatal examination. Thank you.